National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. Today, I'm going to take some time to talk about inflammatory bowel diseases. This is a little bit different from IBS, which is irritable bowel syndrome. Inflammatory bowel diseases are very serious conditions. It encompasses all inflammatory bowel diseases, things like Crohn's, ulcerative colitis, celiac disease. These are all versions of what we call inflammatory bowel diseases. They're often made worse if you have elements of stress in your life, and they can actually be quite debilitating conditions. So this is why we're going to talk about some things today that you can do to help manage inflammatory bowel disease symptoms. So first and foremost, what are those symptoms? Well, some things you may notice: mucus and blood in the stool, extreme intestinal pain, cramping, pain that occurs with eating, pain that occurs without eating, malnourishment, so iron deficiencies, B12 deficiencies, because again, when that gut is inflamed, it's not going to be working properly. You're not going to be able to absorb nutrients the way you're supposed to, and so you're going to have a lot of pretty severe intestinal symptoms. And again, it's often characterized with a lot of frequent bowel movements. So very, very painful condition to have. It can be very uncomfortable. And it also, because of all the bowel issues, can create some social isolation, because of course people sometimes can't get too far from a toilet because urgency can be a problem. So if you do suffer from an inflammatory bowel disease, some of the things you're going to want to do: look for dietary triggers. When I treat this in my practice, almost always there's certain foods in the diet that are triggering inflammation. Isolating those foods and removing them from the diet can be absolutely profound in effect. It's not always 100% curative. I have seen it actually cure these conditions. Again, celiac is a perfect example of that. If you remove 100% of gluten from the diet, you can cure celiac condition. You'll actually notice I don't call it celiac disease. I like to refer to it as celiac condition. The reason is a disease, it doesn't have that treatment. Whereas celiac condition, it just means you can't have gluten, you don't have any inflammation. So the inflammation is triggered by the gluten in that case. So I often find that removal of foods like gluten from the diet can be very effective in inflammatory bowel diseases. Now, that may not be enough. So if you do have recurrent inflammation in the gut, other things you'll want to look at using are anti-inflammatory herbs. I've actually found very effective in my practice. Herbs like boswellia and devil's claw are very effective at reducing inflammation. I'll often combine this with anti-inflammatory enzymes like serratia peptase to again help further reduce inflammation, and that will help reduce the symptoms. The other thing you're going to want to focus on is healing. So things like L-glutamine powder. L-glutamine is a very effective amino acid. It's required both as fuel for the gut cells as well as structurally by the gut cells. So it helps your body to rebuild the intestinal lining, as well as provides the energy for that to happen. So L-glutamine can be very effective. And something else that you want is a probiotic. And the reason behind that is probiotics help stimulate the healing of the intestinal lining, and they help your body to break down your food and release the nutrients appropriately. And oftentimes when you have chronic inflammation, that's going to disrupt the normal colony of bacteria that's living in the gut. And so by taking in a probiotic, you can help restore normal healthy colony of bacteria to reduce inflammation and maintain adequate nutrient absorption and adequate digestion of your food. So if you suffer from an inflammatory bowel disease, I really hope this video helps you out a little bit. Check out more of our videos on our channel, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.